Hello, everyone. Thank you for joining us today. I'm Logan White. I'm the marketing manager here at Mutually Human, and I'm very excited to share with you what we have in store today. We're going to be giving brief overviews of 3 technologies we see as having enormous potential in 2022 to have a variety of positive effects on your organization, such as reducing costs, improving speed or throughput for paperwork, and increasing the potential of your current staff, and ultimately improving patient experiences and outcomes. Cramming 3 of these enormous technologies into a 40-50 minute webinar has been quite a task. So we'd love to spend hours and hours talking with you about each one, but we want to make sure that this is absolutely the most effective and efficient way for you to get a brief overview of these technologies so you can make an informed decision about which ones to pursue for your organization. But before we get into the good stuff, I have just a few housekeeping items to go over with you. First, an email with a link to the recording of this webinar will be sent to you tomorrow. And additionally, with that recording, a survey will be attached to that. That survey will also pop up at the end of this webinar. Please do fill that out. That allows us to make these webinars even better, and also enters you into a drawing where we're giving away several Amazon gift cards, which is always fun. Additionally, please feel free to add questions at any time in the chat. We will be monitoring that and trying to respond live to them. If for some reason we aren't able to get to that question during the respective content session, we will circle up at the end for additional question time. Great. Oh, yes. And also, one more thing about the questions. If you ask a question and we don't answer it, please do check the recording. We might answer it at the end, just a heads up, if you have to leave early. Up first, let's get started. Lori Maxon, who's our VP of Custom Software here at Mutually Human. And today's topic is really exciting for Lori. It's in her wheelhouse, not only because she has extensive experience building custom software of all types, but has deep experience in the healthcare space working in UX, UI design. Lori is uniquely qualified to speak to you today about the wonderful world of custom software and what it can do for your healthcare organization. Lori.
Thank you, Logan. And thanks everyone for joining us today. We're really excited to have you here. I know everybody's really busy, so the fact that you took some time out of your day to join us, we're really grateful for. Like Logan said, we have a lot to go through, so I'm going to jump right in. My job today is really to give you some insight into how custom software can be used in the healthcare space. So obviously custom software is a big, broad topic. So Logan, if you can go to the next slide for me, thank you. And it can include a lot of things. So let's set a little context first. So we describe custom software as software that's designed and developed specifically for your unique organizational needs. So as opposed to custom or commercial off-the-shelf software that's developed for the mass market, custom software is developed very specifically for your organization, your custom process, and your users. So whether those are physicians or patients or back office operational focused employees, custom software is built specifically for what you are trying to achieve. So we've built custom software in many forms. Here are a few that we'll highlight that we see a lot of organizations continuing to invest in. So first is the fully responsive web application, right? This is an application used in the browser, but it can be used across all devices. So laptop, phone, desktop, that type of thing. Another common form that we see is a mobile application. So these are typically deployed to the Apple Store or Google Play. They run really well in a phone or tablet, and we're able to take advantage of a lot of native functionality there. Software can also be built and deployed to a desktop or a workstation. So if you have a designated workspace, such as a nurse's station, that can be a really great option. We've also worked with a lot of healthcare organizations in the IoT space, so connecting with devices or using software to read data and provide patient instructions on how to use a device or track other data relevant to patient care, as well as in the fully embedded space. So generally speaking, across all industries, why are people investing in custom software? So a few reasons that we see time and time again. One is to support a unique processor experience, right? So I mentioned off-the-shelf software. There's a lot out there developed for the mass market and specifically in healthcare as well. And for some areas of your organization, that ends up to be the right solution. Where custom software starts to be a really good and interesting thing to consider is if you have, again, that unique process or experience that you need software tailored specifically for that need. And this is where we often see that organizations are able to gain a competitive advantage here as well. So next, when we think about investing in custom software, we're often considering ROI, right? We're looking at things like increasing efficiency and productivity, as well as reducing human error. And related to both of those is increasing the standardization of your process. What we have seen is if you don't have the right tools in place and you're leaving those operational decision-making in the hands of individuals, it can create a variety of process across your organization. So person A does it one way, person B does it a different way. Whereas when software is built specifically for your organization, it gives you the opportunity to standardize that process in a very repeatable way. So it's easy to train and it's consistently used across all your employees. Another desirable outcome with custom software that we see is control over how your software works, right? Versus off-the-shelf software, you're relying on what features they add to their platform. Where when you own your software, you own that roadmap, you have control over how the software works. You also have more security over your operations because you're deciding what data is stored and how and where that data is stored. And lastly, having access to information to allow you to have the insights you need to identify trends, both good and bad, to help you make informed decisions for your organization. So let's talk a little more specifically about healthcare. So I know a lot of attendees today are at providers, payers, and a few in the pharmaceutical space. So obviously you have even more insight than we do on this topic. But based on the trends that we've seen from our customers in healthcare, these are a few things that we've been seeing continue to gain momentum over the years. So the first is patients are becoming more proactive in their own healthcare. So with access to so much health data from our smartwatches and our health apps and online resources, we're seeing a patient population that's extremely engaged in craving that data and having control over their health. Next, as a healthcare community, there's been an ongoing focus on holistic approach to healthcare. I just read an article the other day that how technological developments are a key factor in improving people's holistic well-being, so particularly as it relates to accessing care. The study showed that 70% of the population said they actually care more about healthcare services they can access than anything else. So that just continues to reinforce the impact of technology is becoming really huge here with things like mHealth and telemedicine and other digital experiences. So we're seeing technology really being able to enable new diagnosis and treatment methods across all aspects of the healthcare industry. So many of our healthcare-focused customers are typically targeting these three goals. The first one here is improving patient experiences. So we think about creating those unique and personalized experiences, and again, seeing things like mHealth and telemedicine start to continue to take form. When we think about improving patient experiences now versus maybe 5 or 10 years ago, we're not only thinking about the time they're spending in your facility, interacting with your staff and your physicians, but also outside of those visits, right? So we think about patient experience of booking appointments, consuming educational materials, reviewing their test results, or learning how to use a new device that they might be using for diabetes or other areas there. Another main goal is to improve patient outcomes. So we see this both as organizations that are looking to improve individual patient outcomes, but also overall health of the population. So I'll share a case study with you about a project that we did with a medical provider in this area. And another advantage here is really allowing you to have the insight you need. So software can provide you with real-time data and trends so that you can see what that impact of care is. So having those healthcare and provider analytics available. And lastly, reducing the cost of care. So we see a lot of this. We see a lot of customers are focusing on workflow and process management. There's a lot of opportunity to improve back office operational efficiencies in things like HR and finance and operations and pre-authorizations and billing and so on. So with today's climate, you know, healthcare and all organizations, but we definitely feel the pain in healthcare, constantly looking at how can we do more with less, right? How can we accomplish what we need to with the limited staff that we have available? So both with custom software and RPA, which you'll hear about from Nav a little bit later, we can focus on eliminating things like repetitive human tasks or double data entry or avoiding human error and so much more so that we can get more done with less and really focus on these three main goals here. So today what I have to share with you is 3 case studies. These are all based on real work that we've done. I can't talk about some of the specifics, but I think I can give you enough information so you can understand and see how some other healthcare organizations have used custom software to achieve their goals. So the first one here is a company called Code Health. So we're working with them to build a new product. It's a web application created to help providers have more options and control over how medical coding is done at their facilities. It also is giving coders out there an opportunity to code on demand. So there's a few main goals that Code was targeting. One, we're integrating with the EMR platform. So obviously we need to have a high level of security there, and it needs to be easy to set up and use from a provider's perspective. 2, it's important to offer very predictable turnaround times as it comes to the completion of charts. Hospitals need to be able to rely on the completion of those charts within a designated deadline. And lastly, we're looking at ensuring the app is designed for coders so that they have all the information they need, but not too much information, because there's obviously some PPI and information in there that we need to protect. But we need to make sure they have all the information they need to complete those charts efficiently. So looking at the solution here, at Mutually Human, we worked with Code to build a web application. It's connecting the needs of hospitals with the skills of these coders. So we'll often actually refer to this as the Uber of medical coding. So it has kind of that two-sided marketplace. So for hospitals, they sign up on the Code platform. What they're able to do is set up their service settings that they want for their charts. So things like, which charts do I want to push from my EMR into the Code platform? I might want to focus on inpatient or laboratory or whatever that is. So which charts I want to push in, as well as be able to view a dashboard with data about how my charts are progressing through the system. So hospitals have access to both this high-level aggregate data, but also detailed lists of the charts. They can export the list to a CSV to create additional reports. On the other side of the world, with the medical coder, when they sign up, one of the things that's really important from a code perspective is that coders are screened, and so we can ensure that they are able to deliver the quality work that this product guarantees. And so coders are guided through an onboarding process where they go step by step to complete a profile before they're even qualified to begin coding on the platform. So they do things like upload credentials, they take assessments, and they're verified through the screening process. The other important part that I mentioned is that the coding interface is designed specifically for coders. So we're able to present the information they need in the order that is most efficient for them to complete the medical coding of the charts. Next up here is Embrace Health. So Embrace Health is a major medical provider. I mentioned this earlier with the case study that was creating a program focused on helping patients, physicians, and medical staff improve their overall health. So the full program included things like books and in-person activities and more, but a major part of this initiative was the creation of a responsive application that was focused on tracking and improving things like your physical activity, your nutrition, and your mental health. So the targets that we were looking at here to create a successful application, first, it needed to contain a large library of content. So there was a lot of content that they had available, and different types of content, things like articles and checklists and videos and recipes, things like that. And so as a user, you needed to be able to sort and view and favorite and filter the content. Second, given the population would have a really wide variety of health status. So again, I mentioned it's patients, it's doctors, it's staff. Obviously, it's more of the general population. So there's a wide variety of health status and goals that people have using this application. So somebody might be looking to lose weight, someone else might be looking to build up stamina. You might be a vegetarian or really into yoga, that type of thing. So with that wide variety of needs and a large library of content, the app needed to be able to present content that was relevant to you as an individual, something that represented your goals, your interest, what you had told the app that you would be interested in. Lastly, in order to drive engagement and really focusing on building a supportive community, the application needed to offer things like competitions or challenges that you could participate in as either an individual or as part of a group to just drive some of that community involvement. looking at the solution here, so when you first join this application, you're guided through building a profile. It includes, you've probably seen these a lot, but it includes things like your current health status, what your goals are, your dietary restrictions, things like that. The portal includes sections for fitness, nutrition, and mental health, like I mentioned, and you can track your progress against the goals that you set up. So it's packed full of great content, including, like I mentioned, articles and videos, recipes, workout videos, things like that. And you're able to search and filter that content. You can also save and share your favorite content, so you can share your content with a friend. As you continue to use this application, content's actually highlighted specifically for you based on your goals and preferences and active challenges. So when you log in, you can see my suggested content, suggested classes. It continues to customize based on what your goals are and what you're looking to accomplish. Another really fun, interesting feature here is connection with a wellness coach. So within the application, you can schedule a consult with a wellness coach or actually open up this messaging and chat with a wellness coach right in the app. All right, the last case study I have to walk you through today is an application created to support two main user types. So young asthma patients and their parents and caregivers. So the main idea of this application is really to track asthma attacks and reward compliance. So a couple of focus areas here. One is the goal was to increase compliance for some of these young patients and reward them for taking their medication as scheduled. So in order to do this, we wanted to look at some gamification strategies. And for the parents and caregivers, the app needed to track their medication schedule as well as surface trends. So when did they have an attack? What was the weather like? In order to start identifying triggers and potentially anticipating asthma attacks. So looking at the solution for this asthma application, this is an example of a platform that's actually both a web application and a mobile application connected. The asthma patient or parent, if they're really young, could download the app on their mobile device and take advantage of things like alerts and reminders and push notifications to ensure that they are taking their medication. They can also log attacks or other activity right there on their mobile device. And then back to that gamification and rewarding compliance, as a patient continues to take their medication, they earn points. And they can use those points to create and modify a little pet creature, as you can see there. So you can cash in some points and buy a new hat or sunglasses or this fancy new bow tie, that type of thing. On the parent side, they can view the medication schedule. They can view the track record of the doses that were scheduled and which ones were taken. The other thing that was really exciting here is they can set up personalized goals and rewards within the application. So if you think about you're a parent of this asthma patient and they're maybe struggling with compliance and not taking their doses as scheduled, you could set up a goal in here that says, hey, if you go 7 days without missing a dose, I'll do a pizza party with you and your friends. And so these goals and rewards can be fully customized by the parent, which makes it really relevant to the parent and kid. And they can even track their progress towards that goal, which can be really powerful motivation to help increase compliance among these young patients. Also, weather was a big factor of this type of asthma, so the application actually integrates with a weather app. So this helps inform the patient and parent, but also it's capturing this weather data again back for parents and caregivers to be able to look at the trends to see how the weather was impacting this patient's outcome. So those were a few case studies. Custom software honestly has endless possibilities, and I know that sounds very cheesy, but the range of problems it can solve is really huge. So a solution can be really simple application that addresses a very, very specific need. Other times it can be a wider reaching solution across departments and different user types, as you saw with some of the examples we looked at. Custom software really, at the heart of it, continues to be creating a solution that is tailored specifically for your needs so that you can accomplish the goals that you're setting out to achieve. So with that, I'd love to hand it back over to Logan.
Thank you, Lori. It's amazing what custom software can do. If you have any questions about that, please enter them in the chat. We can get to them. Up next, we have our Director of Intelligent Automation, Nav Lakey. Nav leads our team of dedicated robotic process automation engineers and has about as much experience as you can have working in the RPA space, given how new this technology is. He has extensive experience in bot design and automation culture as a whole, and has worked with all the major automation solutions available. Nav.
All right, thank you, Logan. Go to the next slide here. Whoops. All right. So thanks again, Logan, and I appreciate everyone taking the time to be with us today. So before I start talking about what RPA is, I'd like to get one thing out of the way and talk to you about what RPA is not. Robotic Process Automation is not a technology that builds or implements physical robots. When I first tell people that I help make bots for a living, they immediately assume I'm building the Terminator or C-3PO, but I assure you that's not the case. Even in today's healthcare industry, physical robots and machines are used to automate a lot of acute medical procedures and even bring efficiencies to medical and pharmaceutical supply chains. RPA is a bit different. So the question is, what is RPA? Robotic Process Automation is a software technology that makes it easy to build, deploy, and manage different software robots that can emulate human actions interacting with different digital systems and softwares on a computer. We use tools like Automation Anywhere to mimic a sequence of human actions typically performed on a computer and build what we like to call bots. So just like people, these bots can do things like understand what's on a screen. They can complete, the right keystrokes, navigate different systems and applications, identify and extract data from those systems, and then perform a wide range of other defined actions. But the thing is, these bots can usually run completely on their own and act as digital workers, getting the work done much quicker and giving us humans back their most valued asset, which is time. Oh, and they can do all of this without the need to get up and stretch, use the bathroom, or even take a coffee break. So before I get into the benefits of RPA and some use cases, I think it would be helpful to show you a bot in action. To set the stage for this demo, back in 2020, during the height of the pandemic, Automation Anywhere developed a solution that allowed healthcare organizations to process complex medical forms that patients would fill out as they weren't able to before. So I'm going to start this video here. There we go. So to continue setting the stage, this specific demo is from a hospital in the UK. So these hospitals required COVID patients to fill out a 10-page form, which included filling out different checkboxes and handwritten fields. In the first piece of this demo, you'll see that Automation Anywhere is able to read and extract info from the forms, including checkbox data around demographics, inclusion criteria, comorbidities, and then successfully input the extracted info into a CSV file like you see here for further processing. So what this bot was also able to do is decipher handwriting successfully from these forms, and then combine the output from extracting the handwriting along with the checkbox data from the kind of initial piece of the demo, and then combine that data for further processing, which you'll see here in a second. So yeah, as you can see, the bot was able to take out all the handwriting successfully, which is always fun to see. And then after consolidating the output, you'll see that the bot is able to input that data into a form. So this is, this demo here is specific to COVID-19 forms, but this tool can be used to extract data from various medical forms. Last year we worked with a customer that had a similar challenge where they had, I think, over 2,000 faxes coming in a day with different medical data. And so Automation Anywhere was able to successfully extract that data and input the data from those scanned copies of the faxes into a CSV used for downstream processing. I think that gives you an idea of what RPA looks like in action. So now let's talk about the benefits of implementing this technology, right? The most noticeable benefit of RPA solutions is the speed at which automations can complete tasks. Incorrect data is another challenge for many businesses, and RPA can alleviate any errors, which can be common when manually performing certain tasks. Another benefit is greater productivity. Whereas humans have limitations on how much work they can do in a day, robots do not. I've been part of projects where bots have executed key processes 24 hours a day, 7 days a week over multiple machines. And certain processes can also see an overload of volume certain times of the year, certain times of the month. And then RPA allows you to scale up the solutions that you've built easily and effectively, getting that work done much quicker. Improved patient experience is often an overlooked benefit when weighing out the pros and cons of investing in RPA in the health industry. Healthcare is an extremely personal industry, right? And by using tools like RPA to automate a lot of the manual back office processing, which is done by a lot of medical professionals in the front line, you're freeing up their time to focus on patient care. Cost savings and fast ROI are no-brainers when it comes to benefits, right? RPA solutions get work done quicker. That means they're saving time. And in many cases, time is money, right? So you're able to see the return there pretty quickly. And then, lastly, by giving back time to your employees, you're making them feel more valued, right? You're allowing them to focus on the work that can keep them focused on the more human-centric tasks like patient care. So ultimately giving them the work that makes them feel more valued, you are improving the employee morale there. So Mutually Human, we positioned ourselves as a strategic partner of Automation Anywhere. I mentioned them earlier. Automation Anywhere is one of the kind of global leaders in the RPA space, and there's a couple of reasons why we've decided to partner with them. First of all, we really believe that Automation Anywhere is one of the easiest tools out there to use. I've delivered bots using other tools, and the simplicity of Automation Anywhere is its real strength, especially when considering the goal of creating a culture of automation across your organization. Automation Anywhere is also the only cloud-native web-based platform in the world, so that makes scalability a real possibility as opposed to just a pipe dream. Some other numbers here. Automation Anywhere has helped deploy over 3 million bots across 90 different countries. And specific to their work in the healthcare space, they've employed global leaders and strategists in the medical community. One such doctor being Dr. Yan Chao, whose focus outside of his patient care in pediatrics is on bringing digital transformation into the healthcare space. So I'm going to go over a couple of case studies here, and I wanted to share this timely case study, which took place at Northampton General Hospital, which is a large hospital system located in England between London and Birmingham. This hospital, they provide general acute medical services to the nearly 1 million people that live in the county, and then they're also one of the biggest employers in the region. So in 2020, when the COVID-19 pandemic was at its height, there was a serious stress on oxygen supply for affected patients. I think that was the case many places across the globe. But in this particular case, the hospital needed to continuously monitor the supply of oxygen to make sure there was enough to meet the needs of the patients, right? So nurses and other personnel at this hospital, they had to manually go onto the oxygen supplier's website. They had to log into the system, pull up real-time data of the oxygen supply, and input that data into a log, which was monitored closely by nurses and other professionals. This was an extremely manual process, clearly with no room for error. So what did the hospital do as a solution for this challenge? So led by their IT team, they put together a RPA solution and were able to stand up a functioning bot within 12 hours. Once they had this bot in place, what the bot did was it went into the system of the oxygen supplier extracted the latest reading, updated a spreadsheet, and then updated a dashboard, which provided regular and instant updates right into the hospital's incident room. This led to over 1,500 hours saved of manual human time spent on a computer, and that time was able to be given right back to key personnel to focus directly on patient care, which was obviously critical during the height of the pandemic. Another benefit is that the kind of always on capability of this automation meant that they were able to monitor the oxygen levels 24/7 without any need of human intervention. The next case study here is for R1 RCM. R1 RCM, they are a global leader of providing technology-enabled revenue cycle management services. Typically, they help other health systems with their revenue cycle performance across various settings of care. Many of their internal and customer-facing processes are manual, they're very repetitive, and they're very high volume. And although R1 does have their own solutions for many of the challenges, there's still a lot of work that falls through the cracks, so to speak. So they looked to RPA as a solution. R1's goal was to create a culture of automation. They really wanted to build out their, what we like to call a center of excellence. And so they went through a really rigorous process involving multiple solutions and ended up selecting Automation Anywhere because of the ease of use, as I mentioned, and then the high focus on security and encryption, given how sensitive a lot of medical data can be. So they invested pretty heavily into building out a center of excellence under the company's kind of broader digital transformation goals. And so they were able to scale up very quickly and ensure that they were building out these automations given the high quality of software and engineering standards. So initially they started off by automating their core business processes, which is claims processing. But over time they were able to process payment and transaction posting, prior authorization, and then other reporting and monitoring as well. And then over the course of 3 years, you can see on the right side here what they were able to accomplish. Over 32 million transactions automated every year. They had over 300 bots or automations in place, and they were able to get those connected across more than 75 healthcare systems in the region. So now that we've gone through a handful of use cases for RPA solutions within the healthcare space, I quickly wanted to just share this slide to illustrate really the scale of opportunity in the space, right? From some of the back office processes that I touched on to human resource operations like employee onboarding, recruiting, engagement, all the way to operations, there's opportunities everywhere, right? And as you begin to automate these processes, maybe by selecting one or two of your critical or high volume processes, you'll start to realize the value that RPA can achieve pretty quickly. And I know Logan mentioned that we will be sending out this recording, so you'll have this, you'll have access to the slide again, but I just wanted to show you the scale of opportunity here. All right, so I wanted to conclude my segment of this webinar by just circling back on a couple things that I've touched on here today, right? There's benefits to RPA across a variety of processes in the healthcare space, right? Let's give time back to those frontline workers so they can focus on higher value work and focus on patient care and kind of find more fulfilling work that way, right? Let's let RPA create these digital workers and then automate key healthcare processes and achieve greater throughput with 100% accuracy, and really focus on reducing critical errors and costs that are associated with data that's sensitive to the healthcare space, right? And then let's leverage digital transformation tools like RPA and even custom software, as Lori just went over, and focusing on reimagining healthcare, right? So tools like RPA can help you get there, but it's all about starting with the right process, realizing some value quickly, then scaling up from there ultimately creating a culture of automation within your organization or business. With that, I'd like to hand it back to Logan. Thank you for your time today, and hope you guys learned something new.
Thank you, Nav. If you have any questions for Nav, please do submit them in the questions and we can address those. Up next, we have Mark Van Holstein. Mark founded Mutually Human in 2007 after seeing too much software out there that didn't focus on the end user, humans. Our president is here to speak on extended reality, a particularly exciting and emerging technology in healthcare. Welcome, Mark.
Thanks, Logan. Yeah, so today we're going to talk a little bit about extended reality. And so first, to set some context, I want to just share a little bit about sort of what is extended reality, what are the different flavors of it that exist out there, to give you some insight, and then we'll dive into one of them in particular. So, extended reality is sort of a blanket term used to cover a variety of technologies. On the far right side here of this diagram, we see virtual reality, which is really a fully immersive experience where you are fully in a digital world. You're typically wearing a headset, and you're not seeing or interacting with the real world at all. It's all a virtual world that you're interacting with. The sort of middle ground one to the left of that is augmented reality. Augmented reality is again, you're wearing a headset of some sort typically, but in this one, you're seeing the real world around you, and it's being augmented with digital objects being placed in that world. And so you can interact both with the real world as well as with the augmented world around you. And assisted reality, which is where we'll dive deeper today, is really focused on a world where, again, you're viewing the real world around you, and the difference in this one is you typically have in your peripheral vision a screen that you can see information on. So you've got kind of this, both the full access to the actual real world as well as the ability to see information on a digital screen sort of right in your peripheral view without having to go to some other device. So that's sort of the scale of things that exist in this XR world. This is just sort of a little example of some of the devices that you may see in this space. So in the virtual reality here on the far side, like I mentioned, this is a sort of a fully encased headset that you'll be in. The augmented reality devices allow you to still see the full world around you while also projecting things on top of it. And the assisted reality device here, the second one, is a device that really gets out of your way. You can see there's nothing covering your eyes. There's just something in your peripheral vision to actually see and experience. And so we've partnered with a company called Realwear to provide this sort of assisted reality type experience to a lot of our customers using their hardware while we provide a lot of the software experience. And so this is the Realwear headset. It's 100% hands-free headset. The interactivity with it is primarily voice driven. And so you can just speak all of the commands that you would like to do, and the headset will react to them. It's a rugged device. It's water and dust proof. It's meant for rugged environments where it is going to get abuse. It's not a super delicate tool. It runs on an Android platform. So developing for it is like developing for an Android device. It's got a boom arm that can adjust and swing around to accommodate for various environments, eyewear, head size, etc. Can be worn on the right or left side of the head. So it's a very flexible device, and again has a work band to be able to adjust to head size. The battery in the device is hot swappable, and so if you've got full shift that you need to be using or wearing something like this for throughout the day, you can hot swap out the battery and keep on trucking without having to switch devices entirely. You can just switch the battery. And then the display on the device itself effectively appears like a 7-inch tablet in your peripheral vision, just like you were using a 7-inch tablet, but sort of affixed to your head and always visible to you. It's got built-in speakers, so both you can talk to it and it can communicate back to you via the speakers. And then it has a built-in camera for photo, video, as well as a LED flash and things like that. So if you need to capture anything, you can do that with the camera. And finally, it's a fully connected device. It has built-in Wi-Fi, Bluetooth, etc., to be able to be connected no matter where you are, whether you're in an environment where you have network access or you're out in the field somewhere and you need cellular access. It can work in either of those environments, as well as built-in GPS and other positioning technologies to know where you're at all times as well. So that's a little bit about this headset in particular. Let's talk a little bit about like why would we look at this assisted reality technology in this healthcare world. And so really this comes down to a few key things. One of those is being faster access to information. I've got a couple of case studies I'll walk through to sort of dive into these different pieces. But this headset can make it a lot faster to access information, a lot faster to capture information. It allows the provider to remain hands-free while having access to and capturing this information. They don't have to be working with a separate tablet or anything like that. Their focus, and unlike like the VR or AR experience too, can be more focused on the patient and the situation around them because it's more direct to the real world. It's not quite so much of a layer in between them. And it can help to reduce geographic barriers to care, which I'll talk a little bit about in one of these case studies. So I've got 3 case studies that I'll walk through. The first one here is focused on this sort of comprehensive monitoring situation. And so, in this one, timing is critical in healthcare, and delays can absolutely be life-threatening. And so, being able to get access to information, critical information from a patient's chart or from the monitoring that they're connected to is really, really important. And so with, you often see situations like we have in the picture where a provider is either using a tablet, or maybe they're pushing around a cart with a laptop or desktop computer on it, and that's their primary way to get access to that information. And you'll typically see them going back and forth between patient care and accessing information on this device. And what the Realwear headset allows us to do is put that information in the peripheral vision of these providers at all times. And so they can remain hands-free, they can stay focused on caring for their patient, but they can see the information they need right in front of their eyes while they're still doing that. Whether that's, again, patient records or important vitals from the equipment that they're attached to or monitoring from. And this can be used in all kinds of information or all kinds of scenarios, whether you're right in front of the patient working with them, whether you're out of the patient rooms and there's a monitoring alarm that goes off and it could pop up in your peripheral vision. You can know exactly who it's for and what the problem is that you can go tackle. And so it really provides a great way to communicate information directly to the provider without them needing to go check some device somewhere or work with a device more directly. The second case study here is this one I mentioned, reducing sort of the geographic boundaries to care. And so in this example, this is a first responder out in the field somewhere. They may have a situation that arises where they need assistance, maybe from someone with particular expertise or insights, and the ability to get them there in person is not feasible, but we still need their knowledge and their insights. And so what using a assisted reality device like the Realwear headset provides is it provides the ability for the on-site healthcare provider to connect directly with someone that's off-site to provide their expertise. And so that person that's off-site can see exactly what they're doing. We can use the camera on the Realwear device to, they can basically have a first-person view of exactly what the on-site provider is seeing. They can communicate back and forth. They can talk just like they're in a regular phone call or video chat. And the provider that's remote can help them, assist them in whatever care they need to provide, while being able to see exactly what they're doing, how they're doing it, and give a lot of insight into that. And so this really helps break down those geographic boundaries to care. This example is obviously someone in the field, but this could be just as relevant for providing care on site, at a hospital, for example, when the expert is not able to be there, they can still provide and call in this way. And then our third case study is around this medication verification step. So just like a provider can wear this headset to get information from the system, they can also use it to really capture information as well. So in this world, you may be in a patient's room, you need to hang some medication from an IV bag. With the camera on the Realwear device, you can pull up the patient's chart, you can see what they need, and with the camera, you can actually look at the IV bag, see the label on it, and check, hey, yes, this is the right thing according to what was prescribed for this patient on their chart. You can hang it, and you can know confidently that the system has looked at it and verified it, as well as potentially even captured, a photograph of sort of an audit trail for what got hung and what exactly got given to the patient. And so it allows you to give some audit trail there, as well as give some automated verification that, yep, this is the right thing to be provided to this patient at this time. And that information can be both pulling up patient chart data for my first example and putting in data and verifying data like this can all be integrated directly into your EMR systems to push and pull data back and forth in any way that's necessary. That's the last case study I have to walk through. So to wrap stuff up, I will hand it back over to Logan.
Great. Thank you, Mark. If you have any questions about XR space programs or anything, please enter them in the chat. We can get to them. We do have a question for Nav. Nav, it says, if you pick a process to make a bot, do you need just one bot, or is it high volume work? So high volume work, do you need multiple bots to manage the one process? What do you think about that?
Well, first off, thanks, Mary, for the question. It's a great question and one that we get asked a lot when we're working with our customers to identify opportunities for automation. So, you're thinking along the right track here, high volume tasks. Keeping in mind that volume is obviously important. Some other metrics that are key to understanding what the capacity of bots will need for an automation is to identify how much time it would take to execute one transaction. Typically that can be done, during the development phase, but really understanding how long it takes for one transaction to be completed, then you can kind of multiply that by volume to get total number, like a rough number, a rough time estimate rather, on how long it would take to execute that total volume, right? And then another thing to keep in mind also is SLAs, right? When do certain transactions have to be completed by? So kind of once you understand the total amount of time it'll take to execute a process and any SLAs to meet, then you can kind of decide if one bot which has a 24-hour/7 execution capacity, if that's going to be enough or not, or if you need to split up that work amongst multiple bots or digital users. So that's typically our methodology for how we kind of get to how many bots we need. So hope that answer hope that answer helps. And if you have any further questions, you can always email me and I'd be happy to chat.
Thank you, Nav. This next one's for Lori on custom software. It says, what are the first steps or what things can I prepare for if I have an idea for custom software?
Sure. So our approach to custom software projects, couple things. The first thing is what we call a free consultation. So this is where if you have ideas or challenges that you're facing. So sometimes people say, all right, here are some of the challenges I'm facing. How can technology help me solve that? And we do a free consultation at Mutual Human, and sometimes custom software is the right solution. Sometimes it might be RPA. Sometimes it might be an off-the-shelf software modified for your needs. So we're happy to talk through what challenges you have and help determine what might be a good way to solve it with technology. If you're in a case where you say, you know, I have this idea, if only we had software that would do X, Y, Z, and you're really thinking, okay, is this something feasible? That's another conversation that we do during that custom or that free consultation. The next thing we do is, you know, one of the things we talk about with custom software is that it's like building a custom house. There's a lot of decisions that you need to make. So our first step after that free consultation is a planning phase. And that's where we can talk a little bit about what are your short-term, mid-term, and long-term goals, and how can we craft software that will help make the impact that you're seeking to make with the budget that you have. So it usually tends to, like I said, it's like engaging with an architect before building your house. So in terms of the information that you would need to prepare, really it comes down to, you know, what challenges are you facing, and what is this, how can you imagine in an ideal world creating a solution for those challenges, and bring those couple high level thoughts to the table, and we can help guide you from there.
Great, thank you, Lori. If you have any other further questions or you think of anything, I'm including this contact information slide here so you can reference it later if you need to speak to a certain person. Just a couple follow-up items. You will receive an email with a link to this recording tomorrow, as well as another reminder to fill out our survey that enters you for our giveaways. And thank you. Thank you for attending. Have a great day.